In today's video, we will be discussing 10 rare cat health issues that you should be aware of. Some of these conditions are not only very uncommon to see in general, but they're also very hard to diagnose and treat. So make sure to watch this video till the end, so that you don't miss out on any of the important information. If you love cats and want to learn more about them, make sure to subscribe because we make weekly videos on all things cat-related. Now let's get into it. Number 1 is feline hyperesthesia syndrome. It's also known as FHS. This is a relatively new recognized disorder that has been described as a set of clinical signs caused by an underlying primary abnormality of the nervous system. In simpler terms, this is a neurological disease where your cat seems to be experiencing some type of pain or discomfort. They often seem to have a twitching motion of their skin. And this twitching can be observed anywhere on the body, including the ears, whiskers, and tail. It can also be constant or intermittent, and sometimes even cyclic. Cats with FHS may also experience other symptoms such as vocalization, restlessness, and abnormal postures. Right now, there's no cure for FHS, but don't stress. Many cats actually improve with the right meds and love. Number 2 is hypertrophic cardiomyopathy, also known as HCM. HCM is a disease of the heart muscle, where the heart becomes thickened, which makes it harder for the heart to pump blood around the body. Cats suffering from HCM typically have a decreased quality of life due to the heart's reduced ability to pump blood. The most common sign of HCM is a heart murmur. Other signs include difficulty breathing, lethargy, and poor appetite. Unfortunately, the lifespan of cats diagnosed with HCM is significantly reduced, and most cats euthanized at the time of diagnosis will live less than 1 year. However, there are ways to prolong their lives with medication and lifestyle changes. Number 3 is feline infectious peritonitis, also known as FIP-FIP, is a viral disease caused by a coronavirus. And it causes inflammation of the membrane that surrounds the abdominal organs and the membranes that cover the brain and spinal cord. Cats suffering from FIP may have a fever, a loss of appetite, weight loss, depression, and an enlarged liver or spleen. Currently, there is no cure for FIP, but there are treatment options available to help alleviate symptoms and prolong your cat's life. There are also some really promising developments in the field of FIP treatment that you should keep an eye out for. Number 4 is polycystic kidney disease, also known as PKD. PKD is a genetic disorder that causes fluid-filled cysts to develop on the kidneys. These cysts cause the kidneys to enlarge, which can lead to kidney failure. Cats suffering from PKD often have high blood pressure, increased thirst, and increased urination. Unfortunately, there is no cure for PKD, but there are ways to slow down the progression of the disease and alleviate symptoms. Number 5 is feline asthma. Feline asthma is a chronic respiratory disease that causes inflammation and constriction of the airways. This makes it difficult for cats to breathe and can cause symptoms such as wheezing, coughing, and difficulty breathing. Cats suffering from asthma may also have exercise intolerance, meaning that they tire easily during physical activity. Fortunately, there are ways to manage asthma and improve your cat's quality of life. Medications such as prednisone and albuterol can be used to reduce inflammation and open up the airways. Number 6 is luxating patella. Luxating patella is a condition that affects the knee joint in cats. It occurs when the kneecap or patella dislocates from its normal position. This can cause pain, swelling, and difficulty walking. Cats suffering from luxating patella may also have a decreased range of motion in their knee joint. Treatment options for luxating patella include medications to reduce pain and swelling, as well as physical therapy exercises to strengthen the muscles around the knee joint. In some cases, surgery may be necessary to stabilize the kneecap. Number 7 is feline vestibular disease. Feline vestibular disease is a condition that affects the inner ear or the vestibular system in cats. This can cause a loss of balance, dizziness, and head tilt. Cats suffering from vestibular disease may also have nystagmus, which is an abnormal eye movement. While the underlying cause of vestibular disease is unknown, it is thought to be caused by an infection or inflammation of the inner ear. Treatment options for vestibular disease include medications to reduce inflammation and support the immune system. Number 8 is portosystemic shunt, also known as PSS, A portosystemic shunt is an abnormal connection between the portal vein and the systemic circulation. In simpler terms, this means that there is a blood vessel that bypasses the liver, which allows toxins to enter the bloodstream without being filtered out by the liver first. Cats suffering from PSS may have a lack of coordination, seizures, and a change in behavior. They may also have an enlarged liver and a distended abdomen. Treatment for PSS includes medications to reduce the amount of toxins in the blood, as well as dietary changes to reduce the workload on the liver. Surgery is also an option in some cases to remove the abnormal blood vessel. Number 9 is feline diabetes insipidus. Unlike diabetes mellitus, which is a metabolic disorder characterized by high blood sugar levels, diabetes insipidus does not involve the pancreas or elevated blood sugar levels. Instead, diabetes insipidus is a condition where the kidneys are unable to concentrate urine, leading to excessive thirst and urination. Cats suffering from diabetes insipidus may also have a decreased appetite and weight loss. Treatment for diabetes insipidus includes fluids and electrolytes to prevent dehydration and medications to increase water reabsorption by the kidneys. Finally, number 10 is eosinophilic granuloma complex. It's also known as EGC. The eosinophilic granuloma complex is a group of disorders that cause an accumulation of eosinophils in the body. Eosinophils are white blood cells that are involved in the immune response. When they accumulate in certain tissues, they can cause inflammation and a variety of clinical signs. Cats suffering from EGC may have skin lesions, ulcers, or plaques. They may also have respiratory or gastrointestinal signs. Treatment for EGC includes medications to reduce inflammation and boost the immune system. While these conditions are rare, they are important to be aware of, as early detection and treatment can improve your cat's quality of life and prognosis. As always, this video is not intended to be a substitute for proper veterinary care. If you notice any of these signs in your cat, please take them to the vet for a checkup.
Thanks for watching.
If you enjoyed this video, please hit the like button and share it with your friends. Don't forget to subscribe and click the notification bell for more content like this.